I guess my experience of video clinics started before the pandemic. So I think my first ever video clinic was on the 19th of June 2019, so well before people have heard of coronavirus. And we believed that it was the right thing to do for our patients, because many of our patients were very stable. We didn't feel that they were getting value from travelling up to clinic, and we could actually pick up all the relevant details via remote monitoring, remote reporting, and over a video consultation. When we set up our video service, we started collecting feedback right from the start, so we've been very conscious of making sure that patient experience is really at the forefront of what we do. Consistently, the feedback is always really positive. It's 94% consistent would want another video clinic, and actually 20% of our telephone appointments, once they've had a video, would never go back to a telephone, because I think it is a richer medium. In terms of the consistent feedback, it was about saving time. It's convenient for patients. Many of our patients now are certainly rheumatology patients. You know, they're working, they're not sitting at home doing nothing, they're active, busy people. So it's convenient for them. In terms of cost, they're not having to pay for fuel and parking at hospitals, and there's significant environmental benefits as well. So in terms of benefits of video versus telephone, like many clinicians now, we have a hybrid of using both. For me, the video modality is just a much richer medium. I just feel it's closer to that face-to-face consultation. You can see the patient, you can see the expression in their face, you can do limited examinations, not for everyone, but certainly for rheumatology. I can look at someone's hands and get a feel for what's going on. And it's also been really empowering, actually seeing people either in their work environment or in their home environment, and understanding that sort of context in terms of how they may cope in their home environment. And occasionally I get people to get up and walk if they're on a mobile device, and actually walk around and show me their kitchen and see if there's things that we could help with. But it's the non-verbal cues, and actually it's really just the eyeballing of a patient that I think is massively better than telephone. And it's interesting, from our patient experience, what we've found is that patients who do telephone consultation, some of the feedback has been that they have found clinicians non-engaged in telephone consultations, whereas it's much harder to be not engaged when you're looking at the whites of someone's eyes down a camera. We spend years honing our communication skills with patients, and really with video clinic it's doing the same thing, but perhaps being clearer in your explanations, using some of the media like sharing screens, sharing imaging from video clinics with your patients. And I just think as doctors, we've spent all our careers learning how to communicate well with patients, and we've suddenly had to rethink how we do it. And I think improving our language and our lay language with people in particular has really helped as well. It's certainly, when I first started, one of the concerns was around what might be legal, what wasn't legal, what was there was a lot of conversation around, can you record consultations, should you, shouldn't you record? There was concerns around safeguarding, and I think as a service we developed our outpatient policy to address that. But I think particularly Avatar Joe, and particularly the principles of remote monitoring, really give you a sort of assurance framework to help take that forward.